According to Diabetes UK, in 2023, a whopping 5 million UK residents have been diagnosed to have diabetes. Of these 5 million UK residents, it's been found that 90% of these diabetes are type 2 diabetes. 8% have been found to be type 1, while the remaining 2% is the other kind of diabetes. Now, in addition to that, 2.4 million people has been found to be at high risk of developing diabetes. Isn't that scary enough? Now, this brings us to the three types of diabetes, which are type 1, type 2, and gestational diabetes. Type 1 diabetes, as we already know, is when a person is not able to produce enough insulin. Type 2 is when the person produces just little insulin, or the insulin produced is not working effectively, which is known as insulin resistance. And then gestational diabetes is when a pregnant woman begins to have high levels of glucose, when in reality, before pregnancy, she was not diabetic. So, with these terrifying statistics, I know you will agree with me that it's very important that everyone puts heads together to ensure that we identify the early stages of diabetes, prevent it if possible, and also avoid any complications that might come with it. And so that brings me to the topic, telling you about the 8 signs of diabetes which you must look out for. And in this video, I'm going to be explaining these signs to you and what we can do to prevent them from happening. So stay tuned. But before we get into the real gist, my name is Peace. I'm a registered nurse working with NHS in England. And in today's video, we'll be talking all about diabetes. Please do not forget to like, share, and subscribe to my channel, because in this channel, we talk about everything health. Now, let's get into it. Remember, due to lack of this insulin in the blood, the body cannot be able to convert or make use of the glucose to produce energy. And if the body cannot produce energy, it leaves the person in a state of fatigue and excessive hunger. So this is exactly what to look out for as one of the signs of diabetes. The second warning sign is polyuria and polydipsia. This means urinating more often than usual and drinking excessively. This is a sign that is usually felt because of high levels of glucose in the blood. And because of this, the kidney is forced to work extra hard in order to eliminate those excess glucose from the blood. And it does this by working so much in producing a lot of urine. And when this urine is produced in very large quantities, it makes the person to urinate more often than usual, especially at night. And when this urination continues for a longer period of time, it leads to dehydration, so making the person feel more tastier than normal. And because of feeling a lot of taste, it moves this person to drink more water. So you see how it goes. This cycle will continue until the blood glucose level is stabilized, either by taking medications or doing other forms of exercise or lifestyle modification in order to stabilize the blood glucose level. So this is a warning sign you should look out for. And when you see this, it is important that you visit a healthcare provider, as this could be a sign of diabetes. The next sign to look out for is dry mouth and itchy skin. This sign is very common in people with diabetes, and this is because in diabetic people, there is decreased saliva production in the mouth, and this leads to dry mouth, cracked lips, and even sometimes the person has pain in the tongue. Due to the dehydration, it leads to dryness in the skin, and dry skin causes itching. Another common sign of diabetes is blurred vision. Changing fluid levels can cause a swelling in the lens in your eyes, and this can change the shape of the lens, leading to blurred vision. Fungal infections are another common sign in people with diabetes. This kind of infections hide very well due to the high glucose levels. These infections can be found in between the fingers, under the breast, around the genitals, or the groin area. So if you begin to notice this kind of infections, it is good to be screened for diabetes. Do you or someone you know have a wound that has refused to get healed after many weeks or months of consistent treatments? It could be because of diabetes. In fact, slow healing wounds are one of the common signs of diabetes. High glucose levels affect blood flow and cause nerve damage, and this makes it difficult for wounds to heal. So, if you know of any person with wounds which has refused to heal, it could be because of diabetes, and it is important that such an individual gets tested for diabetes. Another sign is pain and numbness in the feet. This is also caused by nerve damage. If you're getting value from this, please kindly subscribe to my channel because in this channel, I talk about everything health. So, let's continue. The penultimate sign on my list is unplanned weight loss. Remember, in diabetes, there is usually insulin resistance, especially in type 2. And this means the body will not be able to make use of the glucose in the body to produce energy. This forces your body to begin to break down your muscles and fats. And this leads to unplanned and unexpected weight loss. So this takes us to the next point, which is nausea and vomiting. Now, when the body continues to burn fats, this produces what is called ketones. And these ketones build up to a dangerous level in the blood whereby they begin to cause nausea and vomiting. And that is the final sign I'll be telling you about diabetes. If this is something you really enjoyed, please consider subscribing to my channel because in this channel, I tell you everything health. At this point, it is very important that I let you know that diabetes comes with very serious complications like chronic kidney disease and diabetic coma. If you want to know how diabetes can cause chronic kidney disease, please watch this video here. But for the purpose of this video, I'm going to be explaining to you what diabetic coma is. Diabetic coma simply means a serious complication of diabetes which is caused when the blood glucose levels are either too high or too low. It can actually lead to death. When the blood glucose levels are too low, it's usually caused by taking excess of insulin. But in type 1 diabetes, a serious complication known as ketoacidosis usually occur, but it usually does not occur in type 2 diabetes. Rather, a situation known as hyperosmolar hyperglycemic state is what usually occurs in type 2 diabetes. And this hyperosmolar hyperglycemic state is usually when blood glucose level are as high as 40 millimoles per liter. It is encouraged that for people with diabetes, with a glucose level of 15 millimoles and above, it is encouraged that they should check their ketones. At this point, I would like to explain to us that it is important that any person with diabetes monitors their blood glucose levels regularly. And also, in monitoring these blood glucose levels, do not get confused with the units of measurements because blood glucose levels can be monitored or measured in millimole per liter or milligram per dl. So, know the appropriate range for you and also know the unit of measurement for your glucometer. But if you find it confusing, ask me any question about it in the comment section and I'll be very happy to help you. Now, I've already given the ranges in millimole per liter. If you want me to help you calculate the range in millimole per liter or in gram per dl, do let me know. And I'll also put the conversion range down there in the description. I hope you found this video helpful. If you found this video helpful, please do not forget to subscribe to my channel because here I teach you how to prevent diseases and also maintain good health. Thank you for watching and I'll see you in my next video. Bye for now. The first warning sign to look out for is excessive hunger and fatigue. This is what happens when the body does not produce insulin. Now, due to lack of this insulin, there is increased levels of glucose in the blood, which is known as hyperglycemia.